Welcome back, ladies and gentlemen. We now have come to the second plenary session of the day, Nudging the Right Behaviours. This session will cover the nudge approach to behavioral change as a way to address modifiable individual-level behaviours related to the rise of non-communicable diseases. We'll explore opportunities for government agencies and industry partners to use population data from multiple health sources and develop effective nudging policies, programs, and innovation. This session will be moderated by Professor Teo Yik Ying. Many of us in Singapore and the region know him as 𝗦𝗦. 𝗦𝗦 is the Dean of the Swee School of Public Health at NUS. Internationally recognized for his work in genomics, 𝗦𝗦's work focuses on the development and applications of mathematical and statistical techniques to understand genetic causes of human disease and genetic evolution in the worldwide populations. 𝗦𝗦, please.
Kiesha, and thanks again to everyone for joining this session on nudging the right behaviors. So we are now about 1.5 days into the Precision Public Health Conference now, and quite a number of speakers and presenters have actually talked about genomics and other omics technology, as well as the role of technology and data analytics in public health strategies, as well as this morning we heard about in terms of medical interventions. So I think this morning, the focus was really around some of the medical development, focusing on what happens when someone is already sick. But really, the space is far richer when we consider the parts of the lifespan before a person is actually ill and what people can actively do to prevent or even delay as much as possible illnesses and long-term chronic diseases. So health promotion is one area that I personally believe very strongly in, and that's where the role of technology, the real-time data capture and the implementation of interventions can have a very important role. This is really also where behavioral scientists, the social scientists, the behavioral economists comes in to guide the development of some of these new technologies such that we really have a better understanding towards activating people's behavior. Because I think for a very long time, many of us know the importance of healthy lifestyles, linked to nutrition, linked to physical activity, not smoking, having adequate sleep, or even on alcohol and salt intake. But I think the real question is, in many parts of the world where we possess this knowledge, how do we actually translate this gap between knowing and actually doing? And I always like to ask an audience that attends a public health conference such as this, how many of you actually follow the rules around nutrition, getting your 2 portions of fruits and vegetables, 2 portions of fruits, 2 portions of vegetables every day, and actually having at least 20 to 30 minutes of physical activity in a day? I think right now what we see is that people are much more willing to sign up to expensive gym memberships, perhaps because part of it is to coerce themselves to go for their exercises. When it comes to nutrition, we read about people going on yo-yo diets or fat diets, and how much of this actually has a real beneficial impact to their health. And I think when it comes to matters around health promotion, whether it is around smoking, nutrition, physical activity, mental wellness, sleep, everyone claims that they themselves are an expert because they know best what is good for them. And I think surely in this day and age, there is a wealth of scientific data and evidence using knowledge to actually guide actions and behaviors on individual people. We have real-time monitors now as well, that how do we incorporate the use of such devices to really change the way that people behave, to nudge the behaviors. And it's not just about the technology, because clearly the incentive space is just as important. How do we provide the right incentive to reward people, to recognize people, that right pat on the back for the right kind of behaviors, particularly in health-promoting, health-seeking behaviors? We've heard a lot about the partnership between public and private. And actually, this is again a space that becomes vitally important because innovations and creative solutions, in my opinion, are much more likely to emerge from the private sector than from the public sector. But what does the public sector or even the NGOs, what are their roles here? Their roles actually, it's not just to adopt the innovations and devices, but really to determine which of these devices or innovations are suitable for deployment and for large-scale implementation. And over here, this is really not just focusing on having an innovation that works, but we really want to find out, is it effective, especially at the population level? Is it sustainable from a fiscal perspective? And more importantly, is it equitable to the whole society? And it's not just a technology, a device, an intervention that is affordable or available for only a very small privileged segment of the society. So I think today, this session is really talking about some of the new ideas, the new developments in health promotion, really focusing on people who want to maintain good health for as long as possible, and also in recognizing the public-private partnership and to incentivize people. Really, we have invited a panel of three very distinguished speakers. Firstly, Mr. John Gillman, who is the Director of Health Solutions in Asia Pacific for FitBit, one of the technology that is really helping to guide people on their active lifestyle to seek better health. We also have Mr. Mark Saunders, the Group Chief Strategy and Corporate Development Officer over at AIA Group. And this is really where I look to Mark to guide us on really how is the insurance side thinking about incentivizing, encouraging people to look after their health. And finally, we have Dr. Tan Hwee-Pink, the Director for Research Collaborations and Analytics over at the Health Promotion Board in Singapore. And Hwee-Pink will also be perhaps sharing with us some of the ideas and actual implementations that HPB in Singapore have worked with partners in the private sector, including in trying to provide the right incentive for people to adopt a much healthier lifestyle. So the format of this session will be that of a Davos format. I will invite each of the three speakers in turn to lay down their talking points for between 5 to 10 minutes. There will be no question and answer between the speakers. We will collate all the answers, all the questions, hopefully with good answers, at the end of the free presentation by the three speakers. And over at this point, I strongly encourage our audience who have joined us to post questions using the question toolbar at the side of the window. So without further ado, I would like to start off by inviting John from FitBit to share with us some of the talking points and your ideas and thinking around this space. John, over to you, please.
Why? Thank you very much for inviting me to join the conference today, and really excited to be here and have the chance to talk a little bit about FitBit. I'm an Australian based in Singapore. I've been here for 5 years. I've been working with FitBit for 6 years. And it's been really a tremendous opportunity to sit in Singapore and work really closely with organizations here, such as the Health Promotion Board, who are really focused on how to look at integrating wearable technology in particular into healthcare. FitBit created the wearable category about 10 or 11 years ago. And I remember when I first started with FitBit, we were principally a steps tracker, 10,000 steps a day. A lot of people said the fad would not last, that people would get over wearable technology. I think, one of the really interesting things to come through the COVID period is the focus on wearables and wearable data in particular for healthcare. The way that wearable technologies evolved over the last 10 years is just extraordinary. If you think about, the first trackers were really just steps counters. The device I wear today, Fitbit Sense, has incredibly sophisticated heart rate tracking. It's got an EDA feature, so it allows electrodermal activity, so stress detect on the wrists. We brought health metrics to the wrist through COVID, so my device is tracking my skin temp, my respiratory rate, my SpO2, my heart rate variability. So if you think about that, wearable technology has evolved to the point where it's not a question of how it can integrate, it's a question of exactly what does integration look like into healthcare. And I think that's really, a very exciting place to be. One of the things about Fitbit is the company's always been focused on how to help individuals change their behavior. I don't see Fitbit as a tracker or wearable company anymore. I see us as a behavior change company. I've got a couple of answers that I'm going to give to questions through the session, some more talking points. I can talk a little bit more about how we do, drive behavior change as a company and what that looks like. We know that we help people to sustain behavior change. I think in the last 10 or 11 years, Fitbit has sold roughly 100 million devices, and there are still roughly 30 million people using Fitbit today. So the retention rate, is very high. The main focus for us is holistic. We help people to understand more about their own health and wellness based on their own data. So Fitbit has 4 core areas of focus: activity, nutrition, sleep, and mental health. And they're core to everything we do as an organization. We launch a new product, a new feature. It's taking those 4 main areas of focus into account and helping the individual to focus holistically on their health and wellness. For me, after 6 years, my focus is primarily on my activity and my sleep. We've launched a way for people to really understand their sleep. When I wake up in the morning, I get a sleep score, which is a really simple metric out of 100 that tells me how well I slept. Last night, not so good. It was only in the 70s, but I aspire every day to get to sort of close to the 90s. So my sleep is really excellent. And that metric's based on a whole bunch of different things. So it's based on your heart rate through the sleep, your activity the day before, whether you were restless or not through the night. What we've done is taken a whole lot of data that would excite a sleep scientist, but not necessarily a consumer, and package it up in a way that an individual can understand and in a way, self-motivate to improve their sleep. We work, as I said, we work really closely with the Health Promotion Board. We've done 2 fairly significant pieces of work. One is a supplier and partner for the Health Insights Singapore study, which is ongoing. That's looking at a longitudinal study that's looking at behavioral nudges and the impacts on individuals. And we were the first partner with HPB to launch a project under the National Healthy Population Project, Live Healthy SG, launched in late 2019, ran all the way through 2020, and unfortunately was really impacted by COVID. But really very exciting to partner with HPB and across government. And just another addition, Fitbit was recently acquired by Google, which has opened up tremendous opportunities for us and our partners. I'm starting to work really closely with Google Healthcare, Google Cloud, Google Research, and Google Fit in Singapore and globally, which open up opportunities for even more opportunities into the future. So thanks very much. A bit of an overview about Fitbit.
Thanks very much, John. I hope you mentioned that you didn't have very good quality sleep last night. Hopefully it's not because of having to speak at this conference. Sometimes I have that.
Yeah.
And I think the point that you mentioned about Fitbit moving beyond just a wearable technology that tracks, that focus on step count tracking, but now you brand yourself actually as a behavior company. I think that's a very important point, because right now I do see that the opportunity for many of these devices, including Fitbit, you talk about activity, nutrition, sleep, and the mental health, the 4 pillars. I think this is really where individuals do have different focus, because some people will be much more interested in activity. Some individuals will be much more interested in nutrition. And I think I like what you talk about, passing this data onto the users in a manner that they can easily understand and to actually help them make certain decisions in their life. And I'm glad to hear that right now Fitbit is partnering the Health Promotion Board in Singapore on the Health Insights Singapore program, which is aimed at delivering behavior change to a number of different segments of the people, of the population in Singapore. So I think Hwee-Pink probably will talk a little bit about the High SG study, perhaps. But before Hwee-Pink talks, perhaps I would like to, at this point, to invite Mark to guide us a little bit about how over at the insurer side, how are you thinking about using some of this real-time data that could be captured? It doesn't have to be through Fitbit, but there are many devices, many options now to capture people's activities and people's behavior. But what are some of the thinking processes behind the insurance companies in this space right now? So over to you, Mark.
Okay, thank you, 𝗦𝗏. Appreciate the introduction. Yeah, it was great to hear from John. A lot of similarities in terms of what they're doing at FitBit, in terms of how we're evolving the insurance industry. What I'd like to kick off with, 𝗦𝗏, is just a little bit of a sort of background to how the life insurance, the life and health insurance industries are evolving around the world, but particularly here in Asia. In a nutshell, what the evolution is we're moving from being a reactive payer to being a proactive partner. In simple terms, rather than the age-old practice of underwriting a risk at a point in time, and then just waiting until that event happens, and in so doing triggering a payment from the insurer, we proactively manage that risk by helping our customers improve their health. One of the ways we do that are by monitoring them through wearables, as John described. In fact, you see, I've got a FitBit sensor as well, I use myself. But by helping them improve their health, what we're doing is reducing the risk of them getting sick and suffering untimely death through illness. Yet, of course, our core is if the event still happens, we still pay, of course. We've just helped the insured reduce that risk. So we're focusing more on how we can help the preventative part of the sickness journey, rather than just providing financial support when sickness strikes. So beyond sick care to healthcare, we really do want to keep our customers healthy for as long as possible. And obviously people can understand why. So this evolution from reactive to proactive partner, that's enabled by technology, digital and analytics, and the advancement and adoption of which has been accelerated through the pandemic, again, as John touched upon, and the changes to the way we all live our lives. Specifically AIA, we've got a digitally enabled proprietary AIA Vitality platform that I'll expand a little bit on later as we go into the questions. But core to this platform are the principles of know your health, improve your health, and get rewarded for doing so. So we provide access, tools, and encouragement to drive behavioral change. So again, picking up one of John's themes, we see ourselves as driving behavioral change by helping people adopt healthy habits along the lines of you said 𝗦𝗏 in your introduction. Physical activities, so making sure people are physically active, making sure they get the right type of nutrition, make sure they get adequate sleep. Ideally don't smoke, and ideally don't drink too much. So some of the lifestyle choices that we make that actually are adverse for our health. So in providing that access, what's unique about us is actually we fundamentally integrate this healthy behavior into our insurance product. And again, I know we'll expand on that in a while. And what it does is it produces a pure form of shared value creation. Obviously, our customers staying healthier for longer is good for them. It's good for our business, and it's good for the communities we serve. So it really is a pure form of shared value. As a leading insurer, we're evolving from being this reactive payer to proactive partner. We're moving from being transactional and a potential commodity to being service-orientated and value-adding, thus underpinning sustainable long-term value-creating growth, which everybody wants to achieve. So rather than being passive and waiting for an event to happen and then reacting, we're proactively helping our customers reduce the risk of that happening. That's true proactive risk management, which is at the core of insurance. So specifically, let's get specific now, rather than wait for someone to get ill or die and then paying, we're helping people live longer and be healthier for longer through this proprietary health and wellness platform of AIA Vitality. It's science-backed, it's proven, it's got proven efficacy in improving people's health. And I'll share some statistics with you in just a second. But if people do get ill, we're still a payer. Yet also, with the help of the ecosystem of partners that we're creating, they're world-class proven clinical efficacy to make sure people get the right diagnosis, the right treatment, and the optimal recovery plan, so that they're back to good health as soon as possible. So it's not just, here's the check, I hope that helps a bit, goodbye. We actually want to help you get healthy again as quickly as possible. So reducing the risk of them getting ill in the first place, but also increasing their chances of survival and optimal recovery. I'll give a specific example 𝗦𝗏. The sort of programs or propositions we want to develop for our customers are ones like this. join our program at AIA. We will half the chance of you getting cancer. But if you do get cancer, we'll double your chances of survival. Oh, and by the way, we'll pay for that treatment. Are you interested in that proposition? A very different, more compelling proposition than, look, we'll insure you. If you happen to get cancer, we'll give you a payment. That's very much the way that we want to develop our proposition, really partnering people to help reduce the risk of getting ill. And then if they do get ill, helping them through that by paying for it, but making sure they get the right diagnosis, treatment, and recovery plan. So we're still a payer, but not just reactively. Importantly, we proactively partner with our customers across the health journeys of predict, prevent, diagnose, treat, and recover to help them be healthier for longer. That's simply it. That's good for them. It's good for their families. It's good for their employers. It's good for our business. It's good for economies and societies at large. So if I may so that may all sound good and grand. Okay, so what have we achieved so far? A very valid question. Let me just share 4 statistics with you, if I may, and then I'll complete and hand back to you. So we do so we've had a number of people engaged in these, millions of people now engaged in our programs, these wellness programs. And we've done longitudinal studies, of course. When people sign up for the program, we take basic biometric measures, so their BMI, their cholesterol levels, their blood pressure, glucose levels, things like that. A number of the people who start on the program are in unhealthy states, so unhealthy markers. Of those who had unhealthy BMI and engage in the program, 24% of those have moved from unhealthy to healthy BMI. Quite an achievement, I think, for everybody. If you try to reduce your BMI, a lot easier said than done. But 24% have moved from unhealthy to healthy. 37% of people who had unhealthy cholesterol markers, LDL, have moved into the healthy range. 52% of our members with unhealthy blood pressure have moved into healthy range. And 73% of members with unhealthy glucose levels, HbA1c, have moved from unhealthy to healthy, 73%. And we all know what a silent killer diabetes is or can be, certainly an inhibitor of good health. So those are statistics we're proud of. That's not hundreds of millions of people across Asia yet that have proactively benefited from this program, but that's our aim. It's certainly hundreds of thousands of people who are now much more healthy than they were before. And I'll conclude with that, YY. Thank you.
Thank you very much, Mark. And I think it's quite refreshing to hear that the life insurance companies are evolving, moving from a reactive payer to a proactive partner. You used the phrase partner. And I think this move away from just simply underwriting risk and waiting for events to happen to really proactively helping the policymakers manage their risk. It's very refreshing. You talk about predict, prevent, diagnose, treat, and recover. And I would never have imagined that these 5 principles would actually be something that the insurance companies are embodying. And I think you also mentioned about the bit on focusing on passing the right kinds of data and insights over to the consumers at the right time and helping them to make the right decisions. And I think that really focuses a lot on the theme of what we are talking about. How do we actually shape this space in health promotion where information, insights are passed over to the users and to let this insights actually change their behavior? Because I think that has always been the hardest bit. And from the statistics that you have shared, it does suggest that such partnerships actually work very well to improve and to maintain the health of the policymakers. Now, on this point, I would actually switch over to Dr. Tan Hwee-Pink. So Hwee-Pink, you work in the Health Promotion Board. You lead quite a lot of the developments there in terms of how information and insights are being used. And I know the Health Promotion Board has been very active in reaching out to the private sector, in reaching out to work on the space, on the economics, on the incentives to get people to sustain the right behavior for as long as possible and to keep nudging them along the way. That Singapore, we have 4 seasons of the National Steps Challenge now, where the country actually issue step trackers to people. So I won't steal your thunder, but I believe myself and many of our audience would be very keen to hear a lot about what Health Promotion Board is doing in this space and effectively thinking around how policies at the country level or health promotion programs actually determine how do we think about sustaining some of these long-term nudges. So over to you, Hwee-Pink.
Thank you. Thanks, YY. I've been with the Health Promotion Board for about 3 months just after, but I get a good sense of what HPB has been embarking on, in particular on partnerships with private partners. As John had mentioned earlier, FitBit was one of our key partners. We had the Live Healthy SG collaboration, and then John also mentioned the Healthy Insights collaboration that started in 2019 and is still ongoing. These collaborations on digital health promotion is important on a few fronts. So without such digital tools, I think we have a short-term memory of how well we slept, how many steps we clocked perhaps in a day or 2 days before. But without something that collects that data continuously and a platform to consolidate and tell us the patterns of our behaviors in the past week or month, we wouldn't have very good sense of how we have been doing in terms of adopting healthy lifestyle. So such collaborations with FitBit through Health Insights gives individuals an ability to have visibility on how healthy they have been, not just the day before, but over a period of time, not beyond just diet, physical activity, but also physiological parameters that we capture, for example, from Fitbit devices. But of course, we understand that Fitbit or Android users in particular represents one segment of the population, but we may miss out on another segment of the population who are iOS users. So on the same token, last year, HPB has a partnership with Apple through the Lumi Health program. So this program was launched October last year and is still running. And it is interesting and of course not surprising to see various demographic representations of our users. We tend to get the slightly younger users on the Lumi Health program, but we may lose some segment of the older population who would be probably a better fit for the Fitbit or the Android-based programs. I think these initiatives were backed by the fact that research studies have demonstrated that nudging have achieved, there are some statistically significant positive effects on the effects of nudging through these digital health promotion tools on healthy behaviors, like being more active, having better diets, and so on. However, eventually, from our perspective, of course, the goal is that those healthy behaviors will be sustained, as YY has pointed out, in the long term, that will lead to better disease control, especially for NCDs. But of course, to be able to achieve such outcomes, will need us to have such studies and data collection over a long period of time. Because in the short term, while you could see positive healthy behaviors, they may not manifest in terms of improved outcomes, in terms of disease control. But the flip side of that is, of course, right now we provide explicit incentives to nudge healthy behaviors. Are we able to sustain those incentives in the long term? So that's one consideration. And the second consideration is, of course, we also know that there could be a possible effect of habituation with long-term nudging, that after nudging for a long period of time, people stop responding to the nudges and they may fall back to unhealthy behaviors. So there is this balance I think we have to achieve between long-term nudging to look at the impact on health and then the short-term gains that we achieve in terms of healthy behaviors through nudging. And I think the other thing that the Health Promotion Board brings about is So with the digital health promotion tools, we collect data. We're able to achieve healthy behaviors. So beyond adopting a more healthy lifestyle from sedentary lifestyles, we are also able to connect those nudging and link those to our big bucket of programs, or what we call intervention programs, be it food-related, nutrition-related, or physical activity-related. So through the nudges, we are now beyond looking at the implications on disease control. We also want to look at compliance levels. For example, when we nudge individuals, how effective are those nudges? How many people respond? Who responds to what kind of nudges? And then we try and recommend the more personalized interventions. So for example, if the nudges tell us that some people are more likely to adopt better diets, but would still not adopt physical activity, more physical activity, then Health Promotion Board could, in the nudges, recommend them or refer them to the various healthy diets, for example, through our eat, drink, and shop healthy programs. And then to those who are more prone to physical activities, but would not respond to nudges on diet, we could better link them to, for example, our more targeted physical activity programs. Yeah. So I think these are the two main points I'd like to start off. Back to you, YY. Thanks.
Thank you very much, Hwee-Pink. And I think, again, what you have highlighted in terms of some of the nudges has to be tailored, very specific to individuals' targets, because you talk about people who may be more physically active and less concerned about nutrition and vice versa. So some of these nudges actually need to delve into the psyche of the users for it to be ultimately effective. And you mentioned a very pertinent point, which is a lot of these studies actually need to have long-term data, because from a short-term perspective, many of these health promoting activities, be it around nutrition, physical activity, sleep, tend to have it's not clear what their immediate short-term impact will be, but long-term impact on health, I think that there is this evidence gap that we need to talk about. And earlier on, when you talk about the 𝗬𝗎 Health, you mentioned the younger users. And in fact, this was one of the questions that was posed by one of our participants, Lester Leong, who really asked about the challenges on the elderly, especially those above 80 years old, and how do we think about overcoming the adoption. I think some of these are very good questions that we will come to. And the last point that I wanted to highlight was what you actually mentioned around there were explicit incentives that were given, whether it is part of 𝗬𝗎 Health study, whether it was part of the Healthy Insights SG or Live Health SG that was in partnership with FitBit. There were explicit incentives given to the participant, but there's a number of questions that has emerged from our participants asking around, is this sustainable in the long term? What is the kind of decision and evidence space that policymakers, whether it is at the government level or at the agency level, like for example within HPB, to decide whether such incentives should be given for longer term, for perhaps 10, 20 years? Because if for every dollar that I pay out, I can avert $2 in future healthcare bill, the return on investment clearly will be very positive. But I think some of these decisions, some of these calculations actually require very important insights from behavioral economists. So thank you very much, Hwee-Pink, for that. So at this point in time, I can see that we have had many questions that have come in. Thank you to the participants. And we will now move on to the second segment of this session, which is really focusing on the questions and answers. And I'm glad that our three panelists have kept to the time, and so we have almost an hour for the Q&A, which is great. And I think at this point in time, maybe I would start perhaps on John first, because John, earlier on, Hwee-Pink talk about the sustainability question, and I see that this is a recurrent theme that has actually emerged from 𝗔𝗀𝗃 asking about how sustainable are these nudging programs because of the financial incentives. And in terms of this space, what is the thinking process over at FitBit? Have there ever been any considerations on the cost-benefit calculations or even cost-effectiveness assessment? So for example, if an individual spends about $150 on a tracker now, the benefit that the individual can gain from multiple aspects will produce more cost savings in the long term that more than make up for this $150 spent. I suspect this fiscal argument is often necessary in policy making, as government needs to look at the return on investments. And of course, over at FitBit, I'm pretty sure this will be an excellent marketing strategy if you're able to say that for every $1 you spend on FitBit devices, you get back $5 in health gains, in future health gains. Over to you, John, for some thoughts on this.
Look, it's a really interesting question, and I think all three of us have really answered this question in terms of the integration of wearables. I mean, Mark articulated it really clearly. The value they see from wearable data in insurance is obvious and a huge benefit. Behavior change is a real paradox. It's actually easy to change behaviors, but it's also incredibly difficult to change behaviors. I've worked in behavior change for about 15 years, and the two factors that are really critical to changing someone's behavior are the what and the why. The what is quite easy, the why is quite difficult. So, giving someone a Fitbit does not result in a behavior change or necessarily result in a behavior change, but giving them data and guidance and helping people to understand that if I do this, it's going to mean that. If I watch what I eat, and if I exercise more, and if I sleep properly, if I focus on my mental health, my stress, I could improve or reverse my chronic condition. That's the key driver for Fitbit. And the idea around a cost-benefit analysis is, I think, becoming less and less of a critical issue. A few years ago, there was a definite discussion, say, for employers looking to integrate wearables into corporate health programs. Will there be an ROI? I think it's less of a discussion now. It's more around, how to keep people motivated, how to keep people engaged. And from our point of view, it's really quite simple. Giving someone data and guidance about themselves. And I talked about, my focus on sleep. Even as a sort of seasoned Fitbit user, I still have to go through, a few things to make sure I sleep properly. I have to watch what I eat, what I drink. I know that if I exercise, during the day, I will have a better sleep than if I don't. For me, that's the guidance around, how to improve sleep. There are loads of papers out there that talk about the value to healthcare of integrating wearable data. The reality is it's about the individual buying in to improving their healthcare, their own health and wellness. And that's the key outcome here, I think.
Thank you very much, John. Would any of Hwee-Pink, Mark, any thoughts to add on this space around understanding the return on investment or even the cost-benefit assessment on this? So perhaps I could direct to Mark first, because over at the corporate side in insurance companies, you must have spent a lot of effort in making sure that it actually balances out. Over to you, Mark.
Well, yeah, so just reacting on everything that John said was spot on. Although yes, clearly we've done a lot of financial analysis, and currently our models are, as I said before, we assess a risk at a point in time. That's for a population, so the law of big numbers, and on average we correctly predict when such and such event will happen, and so then we work out the economics of that policy, returning what we needed to return to our shareholders in order to sustain more growth. So in this type of exercise, what we're looking at is, well, what if we could reduce the risk of somebody getting sick? Or even better, a better example, if I may choose cancer again, that was just an illustrative example earlier of a type of proposition. But choose cancer. We all know, if you can catch cancer early, you've got a much greater chance of survival. from an insurer's perspective, catching cancer late is very expensive to treat. But, and it's very, we know that. If you can catch it early, it's less expensive and better for everybody. So we've looked at if we could get certain diseases early, if we can predict them early and therefore help prevent them getting really worse early, how much better that would be for us financially. And therefore, what are we prepared to pay for that? So very, very simply, insurance, that we're committed. We're going to make a payment at a point of time when an event happens. If we can reduce the risk of that event happening or delay it, then it makes sense for us to pay in advance. And then we've got to figure out, back to the point of getting the right balance right, the economic balance right. But we firmly believe that there are other benefits as well. Of course, if our propositions are about reducing the risk of you getting ill, or if you do get ill, make sure you get the right diagnosis, treatment, and recovery plan. That's value added to people. People are prepared to pay for that. So actually, by doing this, we actually attract more business. And then you've got economies of scale coming in as well. So it's, as you can imagine, very complex calculations trying to get the balance right. But at the end of it, if we are true to our purpose of helping people live healthier, longer, better lives, we know intuitively and from the longitudinal studies we've done quantitatively that it is actually better for our business and better for everybody in society. So yeah, sorry, long-winded answer, but I hope it's just reinforced the point.
Yeah, I think that really came up very clearly. And I think actually I would shift slightly to a related question, which is really around tailoring some of these nudges for it to be maximally or optimally effective, because quite a number of our participants have actually asked, for example, 𝗤𝗏𝗃, Exley, Derek Lopez, Lester Leon, Peter, and Clarence, you guys raised questions around how is anyone thinking about tailoring nudges according to ethnicity, according to age, according to socioeconomic status or gender? Because I suppose when we hear John talk about the opportunities on tailoring or choosing what your targets are, but that's explicit targets around whether it's physical activity, around nutrition. But what about sending specific nudges? The actual message that it's sent to the user, such that if I'm Chinese, I'm at this particular age, and I have certain aims in life and targets in life, how would the specific nudges be tailored? Perhaps I could ask Hwee-Pink on this point first, but I will open this to all three panelists. Hwee-Pink, because HPB, you talk about a number of the lifestyle programs that HPB is involved in, together with partnership with different private sectors companies. How is HPB looking at this issue? Singapore, it's a multicultural society. We have Chinese, Malays, Indians, Eurasians, Europeans, and right now a lot more people from different parts of the world are working in Singapore. But how do we actually think about sending these people of varied background, of varied economic background, social background, gender, ethnicity, age? How are our nudges tailored, or even are they sent in different languages? Hwee-Pink, first to you.
Thanks for the question, YY. I don't, at the moment, I don't think we are at the stage where we are customizing our nudges in different languages. However, what we are attempting to do is based on, for example, the 5 seasons of National Steps Challenge data that we've collected. We are trying to create tribes or clusters of participants based on their behavioral types. And if we're able to create those tribes, then we could at least customize our nudge messages according to each tribe. So not at a personal level, but at the tribe level. So that's number one. And then the second thing we're trying to do is we're also trying to look across data coming across different programs and trying to see individual preferences. So for example, if I have a participant who is physically not so active, but from our Eat, Drink and Shop Healthy program, we see that this person regularly purchases healthy choice food options of a specific type, then we could customize our nudges to say, for example, 𝗕𝗂𝗃 has a discount at the moment until when for this particular food type. So this would be more personalized, and it would be something that the users would find more useful, and it can also encourage and continue and sustain that behavior. And I think I'll come back to the earlier question about incentives, but because I think there are some useful points that we can mention. So first of all, from our data, we observed that there is a substantial percentage of our participants who actually do not redeem their points. So they may be accumulating points, but eventually they don't convert them into cash incentives like vouchers. So if we continue to study these sets of data, we might be able to reach an incentive mechanism which will be long-term sustainable. And the second way is looking at incentives not just as a cash payout, but perhaps to give out incentives in the form of vouchers that can only be used to redeem healthier food choices instead of using vouchers to buy anything unhealthy or healthy. So in that sense, even if we do pay out, that would implicitly lead or explicitly lead to healthier behaviors.
Thanks very much, Hwee-Pink. And clearly, I think your point on making sure that the reward system, it's also tied in with health-seeking behavior is a good one. Clearly, we wouldn't want people to get the incentives and end up engaging in buying cigarettes or food products that clearly wouldn't be very good for their health when consumed in excess. And I think at this point, I also want to ask John on this particular question. How is FitBit thinking about tailoring nudges to people of different background? So it's not just having the specific focus on the 4 pillars on physical activity, nutrition, and so on, but it's how this nudges being sent such that even the phrasing or even the specific nudge that is sent to individuals could perhaps be tailored and individualized. Over to you, John.
So personalization is really critical to what we do, and it's based on, no one's health journey is necessarily the same as anyone else's. Behavioral nudges have really been core to what we do as a company. We do this one thing today called reminders to move. Every Fitbit user who has not done 250 steps in an hour will get a nudge at 10 minutes to the hour to let them know they have X number of steps to do. We know that 70% of people will get up and walk around. So we know that nudging people in the Fitbit device or on the Fitbit device does work. We ran a nudges experiment in the US last year, and again, looking at potentially bringing it to Singapore. It was increasingly personalized, focused around our 4 core pillars, but personalized to my preferences, my settings. I get a lot more nudges about sleep in my Fitbit app. In terms of looking at further localization, it's definitely where we're going as a company to make the experience totally wrapped around the individual and based on the individual's need in the future. But we know that nudges do work. Out of that experiment, I think about 90% of people who were on the trial in the US said they really valued getting personalized nudges in the Fitbit app based on whatever their health goals were.
Thanks. And Mark, over to you, but I have a slightly different question for you to put you on the spot a little bit. And I think it's really around how sure are we of the evidence? So how do insurers actually see the evidence on specific behaviors? For example, those linked to nutrition and physical activity, because often this requires very accurate data capture and translating this information to actual recommendations or programs that you offer your policyholders often require a degree of data capture that could be viewed as intrusive or policing or perhaps discriminatory, like what 𝗔𝗍 has posed on her question. So I have 2 questions here for you, Mark. The first is, how do insurers utilize the data on behavior? And is this incorporated in some equation on risk forecasting? The second question is really around any concerns of being perceived as too intrusive by the policy holders and the customers. Over to you, Mark.
Why? Those are great questions, and yeah, very insightful, and things that the people are concerned about. In terms of integrating the data, I've got to be candid, we're still at the embryonic stage. I mean, the wellness platform we use, AIA Vitality, really saw its roots, so just some 20 years ago in South Africa, a company called Discovery. And we've got this sort of franchise for that and the intellectual capital rights for Asia for that. And our longitudinal studies are at the moment only 5 years long. So intuitively, we know and we can make good estimates as actuaries as to what the impacts will be when we assess the data. But you said like things like specifically around nutrition. We've tried some nutrition programs. And all we can do at the moment is, get people to take photos of their nutrition, give them certain points if they do that. Can we make them eat it? Do we know they've eaten it? No, we can't. So we're still at the embryonic stages, until we get to the stage of where you've got ingestibles and sensors inside your body and things like that. Until we're not going to have accurate monitoring. But so let me say we're on a journey, to be absolutely candid. And we're doing our best capturing the data. We are trying to encourage the behaviors we can. Let me give you an extreme example, something that's not been touched on at the moment, going for a medical checkup. We all know at least once a year we should go for a medical checkup. Something that prohibits us is often the cost, right? So people say, oh, I don't want to go because it's going to cost me money. So there's something we can do about that. We want to encourage people to go for regular health checkups. So how do we do that? So we've offered to pay for people's health checkups. Do they go for a health checkup even if it's paid for? No, not really. It's still inconvenient, don't really want to do things like that. So we've really had to rely on behavioral economics. And again, building on the things that Hwee-Pink said and John said. To encourage people to go for health checkups, we found the thing that works best for them is to give them certain status. As they improve their health and do the different things that we will measure, and they maintain it through healthy habits, they can go up a status from bronze to silver to gold to whatever it might be. And this loss aversion that human beings have, once they have that status, they don't want to go. So simply we found very successful, of the order of 85 to 90% of people will go for a medical health checkup if we say, in order to maintain your platinum status, you need to go for a health checkup that we'll pay for. And lo and behold, they go for it. Which then goes to your earlier point actually about personalization. Absolutely, you've got to personalize. Even if you segment your customers by age, by gender, by ethnicity, by social status, people are different. I'm motivated by somebody who could be my twin, could be motivated by something different. So to be truly successful, you have to personalize. Then you get to your point about, okay, too intrusive. Because does AIA now through the data they gather, do they know me better than I know myself? Do they get scary where they say, hey, you need to go for a walk? How do they know I need to go for a walk? I was about to go for a walk. I wanted to go for a walk. So being an insurer, though, we are forced by the regulations within which we have to operate to be very, very careful with data that we have on customers. So we have to aggregate it. We've got to protect it. But do people feel it could be too intrusive? Yes. If I take the United States as an example, which thankfully is not a market we operate in for a number of reasons, but the United States, people are worried about getting genetic testing in the US because it might adversely impact their insurance coverage or their children's insurance coverage or potentially the career of their children. We don't know. So we're aware of people's apprehension about sharing data. But the good thing about an insurance company is we have to maintain the confidentiality of our data. We have a lot of confidential information on all of our customers through the underwriting we do. And we have to absolutely keep that secure. So yes, it is a concern. Yes, it's something we're aware of. And yes, we do everything we can to allay that concern that people may have. I hope that's addressed your question.
And actually, Mark, thank you very much. what you have said addressed both questions, but I would also like to pick up on what one of our participants, 𝗕𝗂𝗵𝗃𝗀𝗃, if I not mispronounced the name, this participant actually asked about the use of genetic testing, very specific genetic, to identify risk factors, these inherent genetic risk factors, and then using that as a way to encourage people to change their behavior. Is this something that AIA is thinking about, given a lot of all the caveats that you have talked about in terms of concerns, in multi-generation concerns? Is this even coming up in discussions within the insurance groups?
So short answer to your question, yes, it is coming. It's coming into consideration. For me personally, I started getting better informed about genetic testing back at the end of 2014. So not a long history. I'm not a genetic expert by any case. But what was very clear, it's a very complex area. And so at AIA, we've considered it. And we've set in place some very rigorous processes if we're going to have any products linked to genetics. And we've got a number of principles. The topmost principle is a person who has a genetic test would not be any worse off taking insurance with us than if they'd not had a genetic test. So we have to set that as a overriding principle. And we've got a number of others. But it is such a complex area for all the areas, all the things we know. But it is valuable in the predictive space. But at the moment, it is not a space we're active in. We are very, very cautious, and we're taking a very measured and considered approach to genetics. As I said, we've got this basic principle that we want, if the fact you've had a genetic test will not count against you in terms of how we, so you will be no worse off than if you'd gone through our normal underwriting. So, so it's principles like that you have to set. And a number of insurers, some insurers have played in this space by encouraging people to get, if I may name 23andMe as an example. So getting a test, which can be a bit of fun. Your evolutionary, how much Neanderthal do you have in you, or whatever it might be, a bit of fun. But we've looked at that and thought, okay, it might be a bit of fun, but it could also be risky. It could have an adverse impact on somebody or something at some time. So we've been rather cautious in this space. We want to find the right way to play in this space because it is a great science and it's a very useful science. But we need to be very, very careful, if that sort of addresses your question.
Yes, it does. Thanks again. And I'm really glad that you mentioned over at AIA, you have consulted behavioral economists, because from the very beginning, I've always highlighted that even though when we think about precision public health, or in this morning's discussion, precision medicine, there's often this perception that it's all linked to the hard sciences, whether it is around genetics, the use of large data sets, you have statisticians, mathematical modelers, you have the omics experts coming in. But fundamentally, actually, a lot of the precision technology, the use of data, really require the lens of behavioral economists, the social scientists coming in to really understand what are some of the trends that we see in the population and how to incorporate those insights into executing the nudges that we are now talking about. And on this part about sustainability on nudges, I think this was also a theme that has emerged quite consistently across our audience. And again, at this point, strongly remind all our audience, if you have questions, please do ask. It is quite rare that we have a collections of private sector people like John from FitBit, the insurers from AIA, Mark, as well as from a government agency such as the Health Promotion Board with Hwee-Pink. So this question, I would like to direct it to both Hwee-Pink first and then to John, because I think we have heard that there is ample evidence now to suggest applying the right kind of nudges at the right time can actually change the behavior of a person quite successfully towards much healthier choices, be it around nutrition, physical activity, hopefully one day smoking as well. But most of this evidence tend to be focused on changes in behavior in the short term. And even when we think about incentives, the incentives are given in the short term. So over time, typically there is a gradual loss in the effectiveness of these nudges. and perhaps people become numb to the nudges and then regress back to the comfortable usual behavior, which is usually not that great and not that healthy. So what, in your opinion, Hwee-Pink, first, what do you think are the key factors for nudges to remain effective for the long term?
Thanks, YY, for the question. I think a couple of considerations. First of all, it is the way that the nudges are delivered. If we're talking about digital means, whether or not and the frequency of nudging, and how long should we be nudging the same message, and also based on their responses to the nudges, then we decide on how frequently we should nudge. And so these are the few ways I think we can try and sustain the nudging, because the worst thing to do is to nudge someone who persistently do not respond to the nudges, and then you keep sending the same nudges over a long period of time. The same way we turn off our ears when we stand on the MRT platform, hearing the same reminders a couple of times every minute. I think after a while, you just shut off your ears and you stop listening.
Thanks, Hwee-Pink. I think that's very pragmatic response that you have shared. And actually, John, same question, but I will phrase it slightly differently. Over at FitBit, what is the thinking process around the role of Fitbit or any devices in general to introduce long-term and sustained changes such that one eventually will pick up those habits independent of whether they are wearing such a tracker or not? What are the thoughts in this space?
So we did some work with a company in Taiwan last year, a diabetes app provider called Health2Sync. I think they're the largest diabetes app in North Asia. And for me at Fitbit, it was looking at the value of integrating a Fitbit wearable into the care of a patient who has been clinically managed by one of the diabetes clinics in Taiwan. We gave 4 clinics 25 devices each, and the doctors gave the devices out to the patients who all had type 2 diabetes. So the program was done under clinical supervision, and I think that's a really important point here. The focus was on helping people to understand the impact of nutrition, activity, and sleep on their diabetes care. And often people don't understand that. People who have a chronic condition, it's overwhelming. It can be very difficult. They don't necessarily understand that if I do this, it's going to mean that, or if I watch this, it could improve that. Over 3 months, and it was a short, sharp study, over 3 months, of the 100 people who started, 96 people finished the program. We saw an average reduction in the HbA1c across the group of 0.33%. People who were nudged to do more activity each day, so people actually achieved 150 minutes of high intensity activity across the week over the course of the 3 months, saw a reduction of 0.66%. A number of people on the program lost weight. Some people lost up to 2 kilograms in 3 months, which is really quite significant if you think about it. 6 months on, we're still seeing people sustaining the change. So what we've done, and it was really important for me at Fitbit, it was important for the clinics, is giving people the information about their condition, giving them knowledge about what they can do to improve their health outcomes. So if I focus on more high intensity activity, if I go for a brisk walk 4 times a week, that means I could improve my outcomes as a type 2 diabetic. For me, that's hugely exciting, and really demonstrates the value of personalizing what we've been talking about. So making the solution wrap around the individual, giving them guidance around how they can improve their own health, and if they keep doing it over time, they could reverse their type 2 diabetes, and a really tremendous outcome that demonstrated for me absolutely categorically the value of sustaining behavior change over long term for a health condition that most governments really struggle with. In Singapore, the government's declared war on diabetes. yet the rates of diabetes in the community are still going up every year. That's the really exciting thing about integrating wearables into healthcare under clinical supervision to help people, really understand and focus on how to change their behaviours over a longer period of time.
Thanks very much, John. And
may I just jump in, just add a little bit? Sorry, because I thought it was great that John said. I just wanted to add something else that we do on top of that John said about helping people understand the condition and what they need to do. We found even when people still got an excuse. For example, not having a good pair of running shoes. So why don't we help people buy running shoes, good quality running shoes? Just that little things like that. And particularly on nutrition, what we do, and back to the example earlier that Hwee-Pink gave, if you go into a supermarket partner of AIA, and some of these will be marked discount due to AIA Vitality, and when people get their receipt, they find that anything that's non-healthy, full price, but anything that is deemed as healthy at the bottom says due to AIA Vitality, you get a discount of such and such and such through buying healthy foods. So it's sometimes as well, we've got to actually, I'm sure John will echo, got to produce the tools for people to actually give them the ability, whether it's as simple as running shoes, whether it is making healthy food cheaper than non-healthy food, whatever that might be. I'll just add on, I think that's very important in actually driving that behavioral change.
Thanks very much, Mark. But I would actually come back to you on this bit about equity, because I have a difficult question for you and perhaps for the insurance companies, which is around advanced economies versus the low and middle income countries. But I'll come back to that in a bit, because there's one question that I've seen really around asking Mark, you very specifically, in terms of the representativeness of the people that you are studying. And in fact, the same question could also be extended to Hwee-Pink in terms of some of the participants in the National Steps Challenge and so on. There's often this belief that people who are active users or actively participating in these programs tend to be already the converted, that we are preaching to the converted. But the question is, how representative are the AIA subjects in your Vitality group compared to the general populations? And do you think that your insights can be broadened and extrapolated to other groups, particularly the vulnerable and neglected populations? But Mark, first to you, in terms of the representations on your AIA samples, where you share the full statistics.
Why? It's an excellent question. I mean, so basically, yeah, it's not inclusive enough for where we want to get to. It is aimed at our customers. Our customers, by definition, are middle class, upper middle class, certainly not low income mass. Right? Those are not the people who typically buy life insurance and health insurance. They've got, in their minds, more important things to spend their money on, which is fully understandable. And simply, some of the insurance products are unaffordable for the huge mass. So that's an area that we've got to work on. There can be different tiered programs that we can roll out, but first and foremost, to answer your question, it is focused at our customers. So how representative of the general population? No, it's focused on the segment that are typically buyers of health or life insurance. Do we want to expand? Yes, but that's the honest answer to your question.
So Mark, you have the answer, you have a simpler answer to give, because I think your catchment populations will be the policyholders, the people who are really interested in this. Hwee-Pink, Health Promotion Board is a national agency, so you do have a much tougher challenge on your hands, trying to get as many people in the country to participate in this. So do you think that the present participation, whether it is in your National Steps Challenge, High SG, or even Lumi Health in particular, really caters to a much more specific group of people in society rather than the general masses? What are your thoughts to this?
I think there is a general assumption that people who get on board such programs, be it Live Healthy SG or Lumi Health, tend to be the already bought over or already fit people. But we do have some evidence, early evidence from, say, the Lummi Health program, that tells us that, say, half the people pre-onboarding, they had pretty sedentary lifestyles. And a couple of months into the program, we were able to convert, say, about half of these people away from sedentary to at least slightly active or moderately active. So I think it wouldn't be too accurate to say that people who come on board these programs are already active to begin with. We do have a significant population who were sedentary or only lightly active. But through participation in this program, some of them have become more active.
I think that will be the reality. Whether it is, again, I suspect if I ask John the same question, I think John will answer it in the same manner, that the users themselves will be a specific group of people. And that's the reality that national agencies like the Health Promotion Board or even private sectors will face. But actually on this point, one of the issues that has been discussed quite a lot in terms of precision techniques or data technology heavy strategies have been really around this concept of equity. And I can't help but think that a lot of the discussions that we are having today in this particular session has been the privilege of wealthier advanced economies. And I think, John, if I could just start off with you and then subsequently moving on to Mark as well. When we start to look at emerging economies or resource poor countries, what is the strategy that FitBit has, as well as Mark, what is the strategy that AIA has to deploy some of these solutions to also look after the health of these people in the low and middle income countries? So John, perhaps over to you first.
So it's a really interesting question. And, we operate in 12, 14 countries across the region. Obviously, our bigger markets, Australia, Japan, Singapore, have a more evolved, focus on health and wellness. We're doing some really interesting things in, in countries that have, what are considered emerging markets, I guess. And interestingly, a lot of it is based on work that the Health Promotion Board does here as well. And some of the work that we've done, particularly around health insights or Live Healthy SG. I think the National Steps Challenge has, generated a lot of interest across the region, and that's a win for us because, these countries don't have their own Steps Challenge programs, but they're looking at wearables to integrate into healthcare. Thailand is a good example. Malaysia is a good example. I've got a call this afternoon with a company in the Philippines that wants to integrate wearables into a big program. And again, that's based on, work that they see in Singapore. So I think the question of equity, is a really good one. I think the challenges that countries face are that there are, the rates of chronic conditions, the rates of obesity, the rates of type 2 diabetes are just exploding in some of these countries. And, governments are desperate for ways to try and reverse that. The key focus, and I made the point before, giving someone a wearable does not drive a behavior change. There needs to be structure behind the program. There needs to be personalization. People need to understand the rationale, the reason why, and people need to own it, and that's the big opportunity, across the region for some of these countries where health issues are out of control and, governments are looking for solutions.
And I think this is really where some of the earlier comments on culture specificity actually comes in to be very relevant. And I think, thanks so much for highlighting that, John. And Hwee-Pink, you should be delighted that some of the work that Health Promotion Board is doing is actually being shared and looked into as a model to be replicated in other countries, particularly in some of the resource poor settings, that they are really looking for the best practices. They don't have the opportunity to experiment, and they are really looking for some of the tried and tested approaches, shape it with the necessary cultural specificity, and to deploy it. And I think this is where there's this role in terms of sharing some of the best practices as we trial with some of these new technologies that are emerging. But Mark, Over to you, your turn now. What is the thinking behind AIA, especially in terms of the lower and middle income countries, the resource poor countries? How are some of the strategies that you talk about focusing on different elements on health and equally being an active participant, proactively promoting health? How does this happen over in some of these other countries?
Yeah, so the main answer to that is through digital platform partnerships that we're forming. These digital platform partnerships, we would like, I'll give Gojek as in Indonesia as an example. So we have a strategic partnership with them. In fact, we're an investor in Gojek. They reach a lot more people across the whole of Indonesia than we reach through our conventional business model. So, but the key is our sophisticated sort of, as I said, proven clinical efficacy, science-backed vitality program is too much, actually, for what people need. We've got to, again, this is a journey, trying to drive population health, improve people's health. So start very simple, making our wellness program and our platform available through our digital partners, with integrated with some very basic, very low premium, basic insurance that could be scenario based or very short-term micro nano type products, where people actually, they get the insurance for cheaper or with boosted benefits if they are engaged on the Vitality program. But dare I say, a Vitality Light type program. Very simple, very straightforward, initially focused on physical activity. So back to both, so Hwee-Pink said very well about those people that are sedentary. You know, if we could just get people walking around a bit, as Fitbit started off in terms of the journey, that's our way. So we reach a lot more through our digital platform partners. We provide a very simple, light type of wellness program and very low premium, simple type insurance that will cover people's general needs, that they will get lower premiums for or higher benefits for if they engage in the program. And that's it. Also as well, linked to other incentives, but linked to incentives that our digital platform partners will provide. So whether it be a Gojek and a ride on a bike, you might save a few cents, a few rupiah, if you are engaged in the program as well. There are different ways of rewarding people. So that's it. Simple, small, and large reach through digital platforms that we wouldn't ordinarily, historically, been able to reach.
That's great, because it's important to hear that the insurance companies are equally focused on emerging markets and not just on the advanced economies, and equally deploying some of these new digital solutions to these emerging markets as well. Now, we have a very interesting comment from two of our participants, Peter Tay and Charmaine Tan, that really talks about how humans ultimately is, if I paraphrase it loosely, is a social animal. And there is always this effect from your peers. And over here, this is perhaps an open question to all three of you. In terms of when we start to look at nudges, clearly what we've been talking a lot right now, it's about very personalized nudges. But have any of you considered the fact that people tend to move around in groups and perhaps share certain activities or interests, and perhaps even exercise and egg each other on when it comes to exercise? Surely the social group impact can have a positive influence to get people to also be more active and healthy. So any thoughts on this? And rather than identify anyone, perhaps I'll just leave it open. Any of you have any thoughts?
I'll jump in first. I'll be brief because I'm sure we're all going to say a similar thing. One of the most successful ways to get people is to get them together in teams or groups and gamify things. So, nobody wants to let their team down. And if it's all as a team, you've got to do a certain number of steps or things like that. A great way to encourage people and drive long-term behavioral change. So I'll just stop there because I'm sure John and Hwee-Pink are going to say something similar. So I didn't want to steal people's thunder.
John?
One of the key things in the Fitbit app, and you've raised a really terrific point, is the social engagement within your Fitbit community. So in my Fitbit app, I can connect with other Fitbit users. I'm connected to about 150 people. And the one thing I can see is people's aggregated steps over the week. It's a terrific motivator. You want to beat people on a daily basis, but it's really positive. And we have a social app within the Fitbit app. There's probably about 20 odd million people who interact with other Fitbit users in the app. We have the ability to create family groups, so parents and children being able to motivate each other. Gamifying or adding that social aspect is really critical here.
Thanks very much, John. And Hwee-Pink, any additional thoughts to what Mark and John has mentioned?
I think just a brief note, we are actually going to do some research on trying to look at who are the people who happen to be exercising at the same time, be it National Steps Challenge, Healthy Insights, or Lumi Health. And in that way, we can kind of identify this sort of group behaviors, and even from these behaviors, hopefully to identify what we know as influencers. And if we're able to identify these influencers that can pull people together, then perhaps using the power of the influencers, they can even pull people who are not currently in the group to join the group. So I think this is an area of research that we are actively looking at.
So happy to hear that HPB is looking into this, because clearly I belong to one of those that when I see on my Facebook that people have been running, then I do get this urge that perhaps I should also get off my chair and think about running in the afternoon. Now, on this part about social animal, and this is perhaps the last question that we will be able to host, it's really around the workplace. Because workplace health promotion, it's a fantastic opportunity for us to deliver a lot of, whether it is health screening, whether it is vaccination, or specific nutrition programs or physical activity programs. The partnering with employers, it's something that I believe has very good possibility. And I know that Health Promotion Board has been very active in this space. Perhaps I could first invite Hwee-Pink, subsequently Mark and John, to comment a little bit about whether your institutions are thinking or already actively leveraging on the workplace, and how is this partnership with the employers looking like? So Hwee-Pink, over to you first to share about what HPB is doing.
So I think we have very established workplace health outreach programs where we target specific employers and to encourage their employees to go for group activities, to go for health screening, and so on. But beyond that, I think we are also trying to reach out to workplaces to do more targeted studies. For instance, with the Health Insights initiative, we're also leveraging on specific workplaces to try and collect data to at least reduce one of the variables. Since if we're able to tap on, say, all the employees coming on board this study, we could reduce the variability of the employment type in our study, and trying to link that with their health conditions. So yes, we're doing quite a bit of stuff on that.
And is technology an important element in this part of the engagement with the employers?
I would say increasingly so, especially in post-COVID situations. Although people are coming back to work, but we still do not have the full workforce. So I think technology and digital platforms will play a key role for that engagement.
Yes, and in fact, if I understand correctly, my own university, NUS, is actually part of, is involved in the HISG study, the Health Insights study. So some of our students and staff are actually participants in it. Thank you very much, Hwee-Pink. So Mark, what are your thoughts on working with employers?
Yeah, sure. So clearly, thank you very much, Huawei. As a life and health insurer, we provide group life and group health, so to employers for all of their employees. And a sensible thing for us is to link a wellness program to that life and health insurance that we provide. Again, better for us, better for the employees, better for the employer if they can be healthier. But I'll share with you actually a personal frustration, because it's something I've been passionate about for a long time. Still, there are many employers around, all they want to do is get the cheapest life and health insurance, right? And so I can understand that. So other things like, well, there's a wellness program. We'll provide the wellness program as part of the life and health insurance package. It will lead to that, and unless it leads to that, you don't need to pay or things like that. We found that very hard to break through that. An employer thinking, all I want to do is just give me the cheapest life and health insurance. So that's something I think as a world we need to address. And actually what's helped it perversely is the pandemic. All employers now are probably more focused on the well-being of their employees than they ever have been through this. So I'm hoping, I hope it's not a naive hope, that employers will embrace companies like AIA. We're not the only one that can provide workforce well-being programs as part of our life and health insurance. And by that, I don't just mean physical. Of course, I mean mental, but also financial well-being. Link it all together as a holistic program for employers to offer to their employees, such that the proposition becomes, we will help you make your employees healthier. We'll provide programs to do that, which is, again, good for you, good for them, good for us. As that is our key proposition, it's something that we're doing. Now, in designing that, I'll share with you, only since 2019, but since 2019, we've had our own workforce testing out what works and what doesn't work in terms of programs. And, you know, yoga sessions work for some, don't work for others. Giving them a sort of immune system, little drink booster things that people can drink works for some, not others. So it's back to personalization. So actually designing a program that we know employees will engage with. To do that, we've walked the talk. I've tested out, I do things now that I never used to do in employment. We have a sponsorship with Tottenham Hotspurs, and we've got football coaches who've not had a lot of football coaching to do during the pandemic. So we've had them in, showing people how to do exercises sat on their chairs and things like that, and at their desk. So we're really trying to walk the walk. It is something we're passionate about, and I really would love employers across the world, across our markets, to embrace this proposition of linking together your life and health insurance together with wellness programs. Thanks, Hwee-Pink.
Thanks, Mark. And I think that in this space, it's clearly underexplored because employers will get aggregate data, because over here, I must emphasize that we're not talking about employers receiving personalized individual health records or information or activities, or whether they have been exercising or nutrition, but at the aggregate level, it helps the employers plan their wellness programs in a much better manner that will be targeted and identify specific groups of people that will really benefit from certain interventions, in whether it is around nutrition, around physical activity, around having a safe environment that leads to mental wellness. Correct. So, John, FitBit and employers, workplaces, what is the thinking? Any partnering and any use of generated data from the workplaces?
Yeah, look, workplace wellness solutions have been a bedrock of FitBit's programs. In fact, we were probably the first wearable company to develop a corporate solution that allowed for a platform for companies to monitor, to your point, aggregated data of their employees. You know, the trend started probably 7 or 8 years ago, and it was focused around steps, the ability to do a challenge, you know, so you could have team A versus team B to do the number of steps. We've seen, you know, particularly through COVID, and Mark talked on this, companies are much more focused holistically around the health of their employees. You know, we get so many requests for companies looking for solutions to focus around sleep, around mental health, and that's, you know, increasingly possible, you know, through the work that we're doing in the FitBit app and with some other companies as well. And I can leave you with one, you know, a bit of data here about Singapore. We did some analysis of our database in Singapore, so 200,000 people who'd owned a Fitbit over the, you know, time we launched here. When people are on a steps challenge in a corporate program, our least active Singaporeans, so people who are doing less than 2,500 steps a day, would walk an extra 1,800 steps a day just being on a corporate workplace challenge. And we were able to sustain that behavior. So they were actually doing an extra 1,865 steps a day a week later. So totally random stat there, but I think a nice way to sort of round this out, that corporate programs and, you know, putting people in a system or a program with their colleagues or with their family actually motivates people to increase their activity level. So you'll be seeing a lot more focus on corporate programs. We're looking at sort of aggregating data. So a company could have a health score. So every day, every employee, their activity, their sleep, aggregated and anonymized, but would go into looking at a corporate health score that would change on a daily basis based on how active people were, how much they slept. Really exciting things going on in the partner space for us, and I think will be really key to the future of how wearables are used in this context.
Thank you very much, John. And I think at this point I would just round up very quickly because we are 1 minute past the time. I think Clive Tan actually asked and phrase it in his question that many programs actually continue to pay in some form or others, whether it's through incentives or rewards, to collect this personal health data. And he posed it as a question that whether this trend of paying for such data collection will persist. And I think through our three panelists today, we have heard that it is not simply just the act of paying, it is how the incentives can be used as part of the journey for the consumers, for the participant, such that they themselves see that, in fact, when I share this data, it helps my own health be improved. So there's too many learning points that we have heard today that I will not attempt to summarize, but I would just end off by thanking John, Mark, and Hwee-Pink for spending 1.5 hours with us and very valuable insights, very wide-ranging insights in the area of health promotion. And I still come back to the first point that I made when I first introduced this session. Health promotion, in my opinion, remains one of the most crucial aspects that we think about the rollout of precision technology-based approaches, because if we have to work on precision medicine, I would say that we haven't done too well in precision public health, that we have to rely on precision medicine. So on that note, thank you once again to the panelists and also to the audience for joining us for this 1.5 hours. Thank you and have a great day ahead.
Thank you very much to our speakers for the insightful discussion. Integrating effective nudging policies, programs, and innovations have been shown to help individuals modify risk behaviors for non-communicable disease, as well as promoting health. In this session, we discussed the roles of nudges, financial incentives, and we probed how we can tailor them to the individual's social demographic characteristics. We also recognize the importance of ensuring that nudges are not too intrusive or annoying. We briefly explored the appropriateness of using incentives in health and how we can determine how well they work, if they're cost effective, and more importantly, if they're sustainable. Perhaps a question that remains is how we, public and private partners, design programs and innovations that encourage individuals to develop good, long-lasting, long-term habits beyond the duration of the programs. One way would be to gamify it, to tap on peer pressure via social engagement and group activities through even corporate programs. Let us know what you think on the engagement wall on the microsite. Ladies and gentlemen, we have come to the end of conference day 2. Thank you very much for joining us. Today's session will be available for playback tomorrow, and you'll be able to access them in earlier sessions through the Programs tab at the top of the page. Once again, thank you. You've been an excellent audience today, and we look forward to having you join us again tomorrow starting at 9 a.m. Singapore time with the plenary session, COVID-19 and Precision Public Health. I wish you all a pleasant day ahead and see you all tomorrow.